Can ulcers cause hidden occult bleeding? Imagine a tiny tear in your stomach lining or the upper part of your small intestine that you can't see. That's what a peptic ulcer is. These open sores can sometimes cause bleeding that's not obvious to the eye. This hidden bleeding is called occult bleeding. It means blood loss that you can't see in vomit or stool without special tests. Peptic ulcers damage blood vessels in the mucosal lining, which is the protective layer of your stomach or small intestine. When these vessels are injured, they can bleed slowly over time. This slow bleeding might not cause immediate symptoms but can lead to blood showing up in stool tests. The blood in the stool isn't always visible, so it's called occult or hidden bleeding. This type of bleeding can cause a person to develop iron deficiency anemia because the body loses small amounts of blood over a long period. Symptoms of anemia include fatigue, weakness, and pale skin, but many people might not notice any symptoms at all. That's why doctors often test stool samples for hidden blood, especially if someone has unexplained anemia or vague stomach discomfort. The most common causes of bleeding ulcers are infection with Helicobacter pylori bacteria and the use of nonsteroidal anti-inflammatory drugs, or NSAIDs. These medications and bacteria weaken the stomach's defenses, making it easier for acid to damage the tissue and cause bleeding. It's important to understand that not all ulcer bleeding is dramatic. Some people might pass black, tarry stools or vomit blood, which are signs of overt bleeding. But occult bleeding can happen silently, gradually leading to health issues if not detected and treated. If you suspect you might have an ulcer or are experiencing unexplained symptoms, seeing a healthcare professional is essential. They can perform tests like stool analysis or endoscopy to find hidden bleeding sources. Proper treatment can heal the ulcer and prevent serious complications like anemia or more severe bleeding. Remember, ulcers can cause hidden bleeding, but with prompt medical care, they are manageable and often reversible. Always consult a healthcare provider for personalized advice and diagnosis.